Assalamu alaikum, this is Dr. Hasna and today we will be discussing the hip joint and more specifically the movements of the hip joint and the muscles causing them. So first of all, since this is a ball and socket variety of joint, hence it will admit the movements of all ranges. Now we know because of the shoulder joint, all the movements for the hip joint are possible because it is ball and socket and shoulder was also ball and socket. However, hip joint has to bear certain limitations, and that is because the lower limb is adjusted for stability purposes. Hence, it does not have that wide a range of motion, although it has all those movements that the shoulder can do. So what are these movements? The first movement is obviously going to be the flexion and extension of the hip joint. These two occur around a transverse axis. So what are the muscles that cause flexion and extension? Flexion can be remembered in the mnemonic FIP. F for flexion, I and P are the iliopsoas muscle. That means iliacus plus psoas major muscle. Alright. Next we have the extension, which can be remembered in the form of HEG, HEG. E is for the extension, H is for the hamstrings that cause extension, and G is for our very important muscle that is involved in standing up from a sitting position, which was the gluteus maximus. Moving on, we have the next set of movements known as the abduction and adduction. The abduction and adduction are going to occur around a anteroposterior axis. The muscles involved in causing abduction are quite simple. We've studied the normal abductor mechanism and we have studied which muscles come into play when we're talking about the abductor mechanism at hip. Very important muscles, gluteus medius and minimus. Adduction is also quite simple because all the adductors of the medial compartment are responsible for adducting at hip joint. These are the adductor brevis, longus and magnus. Now this was quite simple. The next set of movements of the hip joint are the medial and lateral rotation. The medial and lateral rotation occur around a vertical axis. So usually the axis is going to be completely perpendicular or completely at 90 degrees to the motion. Hence, around the vertical axis, the medial and lateral rotation occur. Now, which are the muscles causing the medial and lateral rotation? The medial rotation is caused by those muscles that are causing the abduction, the gluteus medius and minimus, along with the very important, the tensor fascia lata. Lateral rotation of the hip joint is occurring by the gluteal region chapter we studied. All those small muscles that were in the gluteal region were causing lateral rotation. These were the obturators, the obturator externus, the obturator internus, the two gemini, the superior gemellus, the inferior gemellus, plus the quadratus femoris. All of these muscles were involved in causing lateral rotation. The position in which the hip joint causes the ligaments to be the most tensed is the position of extension with slight abduction and medial rotation. Ligaments are going to be very taut in this position. And the position of the hip joint in which the surfaces are most congruent is in a slightly flexed, abducted and laterally rotated position of the hip. Overall, the blood supply of the hip joint is derived from the obturator artery, the two circumflex femoral arteries and the two gluteal arteries. If you remember those anastomosis we studied, the trochanteric and the cruciate anastomosis, that's where it mostly derives its blood supply from. So if this is the head of the femur, this is the neck of the femur, this is the attachment of capsule on the femur. From capsule of the femur, over here the arterial circle formed by the medial and lateral circumflex arteries will give the branches called the retinacular arteries. These retinacular arteries run directly over the neck of the femur and give blood supply to the intracapsular part of your neck of the femur. What about the head of the femur? The head of the femur consists of the fovea capitis. Through the fovea capitis comes the blood supply of the head of the femur, and this is derived from your obturator artery and your medial circumflex femoral artery. So this was the important blood supply of your hip joint. The nerve supply of the hip joint is derived from the femoral nerve, the anterior division of the obturator nerve, the nerve to quadratus femoris and the superior gluteal nerve. So that was all for the hip joint. I really hope you understood the entire topic. Don't forget to subscribe to my channel. Thank you so much for watching.